sublingual B12 is just as effective, if not more effective, than the B12 shots. I guess this is kind of an easy one, but I still see this advertised, get your B12 shot, $50, boost your energy.
Yep.
And this data has been out for quite some time now, but sublingual B12 is just as effective, if not more effective, than the B12 shots. So, you could get a decade worth of B12 sublingually for the same price as a B12 shot. And then you've got the injection pain, the potential for infection. Doesn't happen particularly often, but anytime you're doing an intramuscular injection, you do have the potential for site reactions, pain, infection, all these sorts of things.
Yep, certainly also superior to getting an IV therapy of B12 and other B vitamins.
Yeah, IV, the risks will go up even more. I saw a IV therapy for bloating the other day, which I thought was interesting, because what if a congestive heart failure patient that tends to hold their fluid in their midsection comes in and wants to get rid of their bloating, you give them an IV, you're going to have the exact opposite effect of what you would think. Now, the average person who's dehydrated and they're producing more, ADH, you give them some more fluids. Maybe there's a net diuretic effect there because they're dehydrated at baseline, but just makes so much more sense just to drink water than to go in and have a water IV. Yeah.
Another good example of individualized medicine. Things that are great for IV therapy, potentially esketamine, ketamine therapy, potentially allopregnanolone, which is basically trihydroprogesterone, things that need to be IV. And then B12 would be an example of something that probably doesn't need to be IV. Sometimes even electrolytes wouldn't need to be IV.
Yeah, there's a lot of different ways to get things into the system, and really getting them into the cells is usually what we're looking at.